Hi, my name is Jessica. I'd like to introduce you to my team members Kathleen, Terence, Kate, and Liz, who you will be hearing from shortly. We as a team work for A Plus Consultancy, which is an agency that works with various healthcare networks to achieve high quality care. The following presentation will look at the importance of a positive organizational culture and how we can achieve this across the Western Primary Health Network. First of all, what is organizational culture and why is it so important? Organizational culture, in a way, is the personality of an organization, which guides employees and how they think and act on the job. It is central to the values, beliefs, and interpersonal behaviors and attitudes towards our stakeholders, and ultimately, it determines how successful or how well the organization does its job. The culture of an organization is a key factor not only in achieving an organization's goals, but it also affects things such as fiscal responsibility, employment and retention of staff, including Aboriginal and Torres Strait Islander people, improved clinical outcomes, and patient satisfaction, which are all aspects of achieving magnet-style recognition. If we can create a positive and effective organizational culture, we will also be able to empower our consumers to become engaged in decision making. I'd like to introduce you to Kathleen, who will be talking about achieving magnet style recognition and what is involved in this process.
Thank you, Jessica, for that introduction. Today I will be talking to you about magnet designation, why it is important, and the impact it can have on your organisation's culture. I will also discuss ways magnet designation can be implemented and the cost involved in this process. Let me start by giving you a little bit of a background on what the Magnet Nursing Service Recognition Program is. In the 1980s, hospitals were in the midst of a nursing shortage crisis. The American Academy of Nursing carried out a study in which indicated that out of 163 hospitals, only 41 were able to attract and retain nursing staff. These hospitals were known as the first magnet hospitals and displayed characteristics known as forces of magnetism. These institutions were able to possess qualities which led to an optimum working environment for their nursing staff. Moving forward to the 1990s, the AAN devised a subsidiary not-for-profit organisation known as the American Nursing Credential Center, the ANCC. The Magnet Recognition Program was developed by the ANCC based primarily on the research conducted by the American Academy of Nursing to recognise healthcare organisations that provide nursing excellence. The framework of this program is based on 5 principles, known as the Magnet Model: transformation leadership, structural empowerment, exemplary professional practice, new knowledge, innovations and improvements, and empirical outcomes. Studies and papers written by academics such as J. Award Hanna et al., Higdon et al., and Lacey et al. Have shown that magnet hospitals tend to attract and retain outstanding nurses. This is because of the overall quality of the work environment within the hospitals, the increased recognition of the autonomy of nurses, which in turn leads to job satisfaction and lower burnout rates. Studies in America have shown that the journey to magnet recognition has had a positive effect within the healthcare facilities. This is seen in assisting nursing staff by reducing staff turnover, decreasing the needle stick exposure by 1/3, and other work health and safety injuries, such as musculoskeletal strains, while producing better patient outcomes, such as lowering patients' falls rates by up to 10.3% and reducing the number of patients receiving pressure ulcers per year. In turn, these figures have assisted with demonstrating decreased lengths of stay for patients, better patient outcomes, higher patient satisfaction, and nurse job satisfaction. These are hard to currently compare within Australia, as there are only 3 healthcare facilities within Australia who have the privilege of being awarded this international recognition. To become a magnet designated facility, the ANCC has developed criteria which the Western Primary Health Network must meet. In order for this to be achieved, A Plus Consultancy has put together the following proposal, which you have in front of you. This proposal goes through in depth the following steps, the first of which is to appoint a magnet coordinator, who will be responsible for engaging the staff and introducing Magnet champions into the healthcare facility. The Magnet coordinator will be sent to the ANCC conference this year, which is in Houston, along with a nursing member of staff from each facility. Together, they will feed back information to their respective areas through their open forums. These forums will include non-managerial and managerial nursing staff, allied health members, and members of the community. These sessions will be aimed at fostering the needs of the frontline workers and allowing them to provide care founded on evidence-based practices. In order for this to be promoted to the staff and the wider community, Magnet has conditions which allows for co-branding. It is recommended that during this process leading up to accreditation, Western Primary Health Network rebrands all its official and promotional material such as payslips, memos, including its email signatures and website with the Journey to Magnet Excellence logo. And upon completion of this program, when Magnet designation has been awarded, this is amended to Magnet Recognized logo. Undertaking the demands of Magnet recognition requires a substantial financial commitment from its organisations, in addition to other resources. However, figures indicate that the increase in revenue will be greater than the increase in costs. The Magnet recognition program is not cheap, with its application fee beginning at $5,000. It is estimated that the initial outline would start at $100,000. This is based on Western Primary Health Network's license for up to 399 beds and would include 4 surveyors over 5 days and include their accommodation and travel expenses. Accreditation will take some time, planning and patience, and a well-developed budget with the potential to make structural changes and increase the operational margins for the organisation. In summing up, Magnet designation is a worldwide recognition for nursing excellence. This is not awarded to health organisations but is earned. In receiving this, you are privileged with the highest level of honour awarded by the ANCC, recognised as gold standard in nursing care. Thank you.
Thank you, Kathleen, for that thorough explanation. I'd like to introduce you to Terence next. Terence specialises in the fiscal aspects of health management, and he will be talking about how we can promote fiscal responsibility across health workers in the Western Primary Health Network.
Hi, my name is Terence. I work for AU Plus Consultancy, and I'm going to outline the importance of frontline staff being fiscally responsible and its correlation to positive workplace culture and enhanced performance outcomes. Healthcare is expensive and costs continue to grow at a rapid rate, but the budget, although large, is finite. Promoting fiscal responsibility is important in all organisations, and this is also true in healthcare, as we need to make the limited resource available stretch as far as possible. Commonwealth of Australia 2014. Knowledge is power, and if all staff at Western Primary Health Network are aware of the costs of care they're delivering, they can be more responsible for the use of resources by making informed decisions. It has also been demonstrated that employee job satisfaction can be achieved through empowerment by increased participation and contribution, part of which includes financial awareness and involvement. Venkatesh Ashke 2002. Venkatesh Ashke 2002, page 31, state that an individual without information cannot take responsibility, yet an individual who is given information cannot help but take responsibility. The greater the understanding employees have about the financial aspects of healthcare, the more effectively they can contribute. Employees with poor job satisfaction who feel no commitment to the organisation are more likely to be unconcerned with the organisational outcomes and its continued viability, and therefore be unaccountable for resource use and can lead to waste, which can lead to waste. Walvin et al. 2003. Employee job satisfaction from feeling valued, which is achieved through empowerment and participation, contributes to a positive organisational culture. This can then equate to increased productivity, retention, commitment, motivation, and morale. Commonwealth of Australia 2014. In turn, this can help the organisation meet its objectives. Motivated And committed workers who are aware of and share the organisational goals will share the responsibility and the outcomes of the organisation, including its financial performance. This is important as it will help inform decision making and the use of resources and encourage workers to create operational efficiencies through creativity and innovation. Golfsani and Chirani 2016. To promote fiscal responsibility throughout the network, Western Primary Health Network must decentralise financial awareness to all stakeholders so that not only the executive have the information responsibility for financial decisions and management. This should be included in the organisational goals and strategy and be built into the structures and be reflected in its policies and procedures. For all staff to be fiscally aware, empowered and responsible, they must not only be aware of financial outcomes of the network, but should be provided with education that provides them with a framework to understand costs in healthcare, enable them to interpret budget information, how to monitor costs, and how to be efficient. Waldman et al. 2003. Western Primary Health Network should do this by developing a mandatory education program that all staff commencing within the network must complete within 12 months. This mandatory training should outline where they obtain budget information from, financial drivers within the network, instruction on how to monitor costs they have direct control over, and it should also contain real-life exercises to develop understanding and for staff to demonstrate comprehension. Budget reports on actual performance should be provided regularly to all staff and should be a regular agenda item at all staff meetings. Other ways of making staff aware of the actual cost is by detailing and promoting the actual costs of materials or services to those using them. Simple examples of these in healthcare are labelling stock items and outlining linen costs. Programs within the network should be developed to encourage and reward staff to innovate, create efficiencies and cost savings. Evidence shows that permitting staff to contribute beyond the day-to-day routine work can produce stronger financial performance. Waldman et al. 2003. The cost of developing and running the financial education program for employees will be offset by savings made through careful decision-making, innovation, creativity, and efficiencies made by an informed workforce. It will also provide staff with job satisfaction and enhance skill development and inclusion, leading to staff retention. Communication of Western Primary Health Network's commitment to fiscal responsibility should be demonstrated from recruitment by being incorporated into the position descriptions, then orientation programs, but it should not end there. There should be ongoing promotion throughout employment with regular newsletters providing updates on performance. Thank you.
Thank you, Terence, for your insight. Next, I would like to introduce Kate, who will talk about the importance of employment and development of opportunities for Aboriginal and Torres Strait Islander people.
Hello, my name is Kate Ebbett. In this part of the presentation, I'm going to discuss the importance of creating employment and development opportunities for Aboriginal and Torres Strait Islander people, and how this will contribute to creating a positive organisational culture. First of all, I'd like to put this into context. Back in 2008, the Australian government made it a national priority to improve the health outcomes and life expectancy of Indigenous Australians. The aim was to ensure the health of the Aboriginal and Torres Strait Islander population was equivalent to the non-Indigenous population by 2030. This commitment was called Close the Gap. From the latest statistics in 2013, the life expectancy disparity for men remains at 10.6 years, and for women it's at 9.5 years. Despite being almost 10 years into the campaign, we are still failing the first people of Australia. Since primary healthcare is the Western Primary Health Network's core business, we believe the network has a responsibility to utilise its standing in the community to improve health delivery. One way of improving Indigenous healthcare delivery is to hire and retain Indigenous staff. This is known to improve engagement with and access to culturally appropriate care. It is important because it ensures that health services have capacity to address the needs of the Indigenous population. At A+ Consulting, we believe that building the Indigenous workforce will also contribute to creating a positive workplace culture, which embodies trust, collaboration and respect. But employment is only one part of the pie that can contribute to positive organisational culture. The Close the Gap Committee advises primary health networks to focus on 3 key areas. These are engagement, cultural safety and employment. Through genuine engagement and providing culturally safe workplaces, we can attract Indigenous employees. These 3 key areas are essentially interdependent. For example, you won't be able to employ people unless they feel culturally safe. And you won't get community engagement without Indigenous representation in the workforce. Currently, Aboriginal people are underrepresented in the workforce. At a minimum, there should be what they call population parity. This means the Indigenous workforce percentage should reflect the percentage of Indigenous people in the community. Currently, the New South Wales health target is 2.6%. But how does this tie into the organisational culture theme? Well, you may remember the iceberg analogy. Above the water, there needs to be obvious strategic plans with policies, procedures that commit to employing Indigenous Australians. But what about the items below the surface of the water? Sometimes there is disconnect between the way organisations say they do things and how they really do things. To promote positive workplace culture, the Western Primary Health Network needs to embody the vision and values through action. What if we made regular engagement with Aboriginal community groups a new norm? What if we had Indigenous representation on the clinical committees and in roles of clinical governance? In whatever strategies we use, the key principles are the same. On the screen now you can see the New South Wales Health key characteristics of creating positive workplace culture. But put in simpler terms, I believe we should create positive relationships, use SMART goals, actually do what you say you're going to do, role model the behaviour and language that you expect of others, and monitor and evaluate the strategies regularly using patient-reported outcomes. At A+ Consulting, we recommend 3 major strategies to optimise recruitment and retention of Aboriginal people. The first strategy seems a little bit different, but it is to convert the current Aboriginal health service into an Aboriginal community-controlled health service. These services are what they call preferred providers of Indigenous healthcare and are key employers of Aboriginal or Torres Strait Islander people. They call them ARCHOs and they employ a majority of Indigenous staff, including most of the people on the board. Obviously, this would have a significant cost associated with implementing this strategy, but it essentially is a care model that addresses cultural safety and engagement, which will in turn optimise Indigenous employment. If this is not within the financial scope of the network, then it is essential to make strong relationships with the nearest ARCHO to incorporate their employment strategies. Secondly, the next strategy is to create an Aboriginal Health Committee with key elders and primary health network managers, which need to meet monthly to facilitate positive partnerships. At these regular meetings, relevant policies such as the anti-discrimination policy and the Indigenous employment policy can be reviewed and updated. I recommend utilising the current frameworks that are already in place. These include the National Aboriginal and Torres Strait Islander Health Workforce Strategic Framework, as well as the New South Wales Health Good Health, Great Jobs Framework. Thirdly, we suggest creating an Indigenous Employment Action Plan. And the Aboriginal Health Committee, which you created in the previous step, would create this and implement the plan. The Sydney Local Health District has a comprehensive action plan, which we can model off. However, through engagement from the committee, this action plan will be specific to the people of the Western Primary Health Network. Common strategies include providing flexible recruitment processes, providing staff with mentors, liaising with TAFEs and unis to identify potential employees, and also utilising the fantastic resource called Stepping Up, which is an online resource for both employees and employers. These are all great ideas, and I could go ahead and say, do this, this and this. But I feel that this is what has been done in the past. Perhaps the Aboriginal Health Committee has a completely different idea on how to optimise the Indigenous health workforce. The action plan, once decided upon, should be promoted by incorporating it into the staff orientation program, advertising it on the internet, and promoting it through social media to the community. In conclusion, I invite you to give the decision-making powers back to the people who it will affect, and I believe this will be the ultimate measurement of a positive workplace culture. Thank you.
Thank you, Kate, for your thorough explanation and insight about the involvement of Aboriginal and Torres Strait Islanders to create a positive workplace culture. Last, we have Liz, who will be looking at corporate governance.
Hello. A positive organisational culture is integral to an organisation's growth. In accordance to leading governance, good governance is about developing a culture which allows your organisation to thrive. Through the development of a strong and transparent governance process, Western Primary Health Network can influence and achieve their goal of positive organisational culture within the next 3 years. Definitions. Leading governance determines that well-governed organisations are those that have a clear vision, a positive culture, agreed targets and expectations, great customer relations and stakeholder involvement, and robust policies and procedures. So what comes first, the governance or the culture? Neither. They develop together. Western Primary Health Network provides a range of services across 6 sites in 4 neighbouring suburbs. The range of services include general practitioner after hours, mental health, substance use rehabilitation programs, immunisation, Aboriginal and Torres Strait Islander health, chronic disease prevention, and sexual health. Ultimately, these services and the network are governed by the Australian Government and the Department of Health. However, a series of systems of rules, practices and processes are required for the organisation to be directed and control this variety of services. The corporate governance of the Department of Health is outlined here. Accountable to the Executive Committee, a series of committees provide leadership for corporate decision making. In order to achieve the governance and strategic requirements of the Department and Executive, the Western Primary Health Network Board will need to provide a governance system that allows systematic completion of the governing requirements. In order to ensure that this supports a positive organisational culture at Western Primary Health Network, this system will require transparency and buy-in from the 100 frontline workers. So how can we achieve this at Western Primary Health Network? An extension of the committee structure of the Department of Health involving stakeholders across the different services and sites should be implemented to ensure each element of these attributes is addressed, providing an environment conducive to positive organisational culture. By leveraging the current organisational structure and building in governance committees responsible and accountable to each other across the network, reporting to all staff and stakeholders, beginning with the board. From this diagram, you can see how corporate and clinical governance transparency can be achieved through the establishment of site stakeholder committees, responsible for reporting to a combined site committee and onto the board. This governance also flows downstream so that when decisions are made, implementation has accountability through the governance system and delegation through the different committees. So how does this structure demonstrate good governance and a subsequent correlation of positive organisational culture? It demonstrates the Australian Commission on Safety and Quality in Healthcare's 10 attributes of good governance within the structure. The rule of law. The structure ensures regulatory compliance through governance, demonstrating to stakeholders the organisation is protecting them, from reporting at the site level to reviewing at the combined site to providing recommendation and implementation from the board. Transparency, the implementation of a system to ensure easy to read and access to information, development of policies and protocols through recommendation, and that applies to every aspect of the organisation. The structure provides responsiveness. The implementation of this system allows stakeholders to view a pathway to address any concerns. Equity and inclusiveness. This structure provides an opportunity for all stakeholders' involvement in the corporate governance and decisions of the organisation, from the site to the board. The hierarchy of committees being short in the 3 levels assures effectiveness and efficiency. It also provides accountability through the transparent systems of each level of reporting, and it opens up opportunity for participation. Governance is inclusive from site to combined to board. So this methodology and implementation of this methodology for governance will ensure culture is influenced across multiple levels of the organisation, from individual culture to professional or divisional subcultures to the entirety of the organisation. Communication and demonstrating how the Commission's 10 key attributes of good governance are incorporated into our governance structure will provide transparency. We can achieve this through the publishing and sharing of key decisions made from the committees, through the membership's dissipation, as well as staff emails, notice board communication, and general meetings. This implementation of a governance framework promoting inclusiveness and transparency will influence a positive organisational culture across the next 3 years. This can be tracked through staff survey and should not require any major expenditure, as it leverages our current structures. Thank you.
Thank you, Liz. That brings us to the conclusion of this presentation. Just to summarise the main points, as Terence said, creation of a positive organisational culture affects increased productivity, staff commitment, retention, motivation, and morale, which have an effect on the finance of an organisation. At a staff level, it is important that all staff are aware and have a good understanding of the financial constraints and budgets in their ward or workplace. This can also promote decision-making at a staff level. Ensuring that corporate governance remains transparent across all sites also influences the culture on different levels of the organisation. Liz recommended the strategy to extend the committee structure across the board to involve stakeholders across different sites, and we hope that this achieves the outcome, as this strategy will help to open up communication and increase participation. Due to the disparity of Indigenous and Torres Strait Islander people, as Kate said, we do believe that this is the Western Primary Health Network's responsibility to address Indigenous health by optimising Indigenous people's employment and development opportunities. This will improve engagement with this group and provide empowerment to them, which is a reflection of the organisation's positive culture. And to end it off, ultimately, achieving magnet-style recognition through creating a positive organisation culture and their strategies is the best reflection of a health system or health network, because this recognition is earned rather than awarded. Creating a positive organisation culture can be time-consuming and costly, but in the end it is reflected in the level of care or service that the organisation provides, the people who are part of that organisation, and in consumer satisfaction. We'd like to thank you, the Western Health Primary Network Board, for your time, and hope that we've provided enough insight into the strategies which we can use to create a positive organisational culture in your health network. Thank you.